This is video 2 of module 1, Neurofeedback Foundations. The purpose of this video really is to get you so excited about what you are about to learn. This modality, again, and I can't say it enough, is just so powerful to help your patients and clients. So the questions we're going to answer in this video are: what is neurofeedback? How is neurofeedback different from psychotherapy and other forms of brain training? Who can benefit from neurofeedback? What ages can benefit from neurofeedback? And how do you do neurofeedback? First, as a little bit of a background, I want to cover the biopsychosocial model of health. So this was proposed by George Engel back in 1977. He was a physician, a psychiatrist, and internist who realized that a great deal of the ailments that were presenting in his office had nothing to do with a physical cause. So he proposed this model of health. And what he said was that mental health, and actually overall health, is an intersection between biological, psychological, and social factors. So biology, meaning your genetic vulnerabilities, celiac disease, broken bones, ruptured discs, effects of drugs that you're taking. Then there's the psychological portion, which includes your thought life and your coping skills. And finally, your social environment has an impact on your mental health, family relationships, family circumstances, economics. Say there's a war going on in the world, things that are going on at school. If you're a child, is the school well staffed to monitor for bullies? And this just revolutionized, or it should have revolutionized medicine. I feel like medicine really has struggled to integrate this into care, but it has been championed by psychologists, and really social workers have been the ones that I feel like have championed this model the most. But I will give you an example. In my personal experience as a general pediatrician over the last 25 years, I very often had patients that would come in with abdominal pain. And I would always do a workup to make sure they didn't have a parasite, Giardia, make sure they didn't have celiac disease. I would test for food allergies. If all of those, stool studies and tests would come back negative, obviously x-rays, a very common cause of abdominal pain in children is constipation. If they had that, we would deal with that. If all of that was negative or treated and they were continuing to have abdominal pain, I would send them to the pediatric gastroenterologist. There they would have an upper endoscopy and a lower endoscopy, maybe even a few more lab tests. But oftentimes, all of that would be completely negative. And what I found over time, and what other people have found, is that probably 70 to 80% of those patients that presented to my clinic over the last 25 years with abdominal pain actually were struggling with anxiety. There are other studies in adults of individuals with chronic pain that have found that 90% of those patients, it's actually psychosomatic. So, all of these factors really must be taken into account. And I feel like psychologists do a really great job in that bottom right circle there. and social workers do a really great job on that left little circle down there, and physicians do a really great job on that upper circle. But we have largely, a lot of us have failed to really integrate all three of these things. I believe that psychologists and social workers would actually do more in the biological realm if they had the tools. So I know that psychologists and social workers aren't able to order lab tests, and they aren't able to order genetic screens, and they aren't able to order CAT scans and MRIs, but they would if they could. And so I'm really excited to tell you that QEEG brain mapping is a biological diagnostic tool, but it's so much more than that. So that is just as exciting for me to share with you, and for physicians who are willing to break out of what they know and expand their knowledge. QEEG brain mapping is going to be phenomenal for you too. You have a lot of diagnostic tools, but you are so limited in what you use in pharmacology. This is going to, for treatment, this is going to expand your treatment capabilities beyond your wildest dreams. So what is neurofeedback? In simplest terms, it's physical therapy for the brain. According to the International Society for Neuroregulation and Research, neurofeedback, also referred to as EEG biofeedback or brainwave training, is a type of biofeedback in which individuals are trained to improve their brain function. So it's important to note here that you are not your brain, but you're dependent on it. For about the last 100 years, scientists have been searching for the seat of human consciousness. But recently, a group of neuroscientists have gotten together to say, hey, we actually don't think that the seat of human consciousness is in the brain or even in the body. They have inadvertently proved what most religions have been saying for a very long time, thousands of years, that you have a soul. And some people call it the mind, and that's just fine. But if you have the willingness to think even more outside the box, I would encourage you to explore that more deeply. I decided to do a deep dive, and guess what I discovered? There are people who have known this for thousands of years that were scientists as well. Plato is one of them. And he used this analogy, and this is why I have this painting up here. This is called Horses and Chariot by Geoffrey Key. It was painted in 1985. So Plato used this analogy. He said that the human brain is like the horses that are pulling the chariot, and the mind or the soul is the charioteer. So, and I'm using this analogy, I'm telling you this because it's going to serve a purpose here. But I wanted to tell you also, Plato went so far as to say, now, listen, he was born in 428 BC, and how people like Plato and Socrates understood these things is just wild. But he went so far as to say that one horse represented logic and the other horse represented passion and impulsivity. And it so mirrors what we know about the left and right brain today. It's fascinating to me. But I think this serves as a good analogy here, because psychotherapy is dealing with the charioteer. So training, essentially, when we do talk therapy, we are training the charioteer how to control his horses, right? And other apps like Peak and Lumosity, they also are training the charioteer to adjust how it handles the horses. TMS, on the other hand, does work with the horses, right? Transcranial magnetic stimulation is what TMS stands for, but it is a diffuse, basically, shock to the two horses. It's not targeted or specific. Neurofeedback, QEEG guided neurofeedback, on the other hand, is extremely elegant, targeted, and specific. In essence, it trains each horse where they're misbehaving or struggling. They may need to work together better. They may need to listen to the charioteer better. They may need to be desensitized to scary things in the environment. They may need to slow down. They may need to pick up the pace. So my point here is that talk therapy and neurofeedback are quite different and unique. They're not mutually exclusive. So sometimes we can calm the brain down or wake the brain up or work in different parts of the brain to help it work together better, each hemisphere or the frontal lobes with the occipital lobes. But sometimes we still do need talk therapy. Interestingly, oftentimes when people's brains are working better, they don't feel like they need talk therapy anymore. It's been an absolutely fascinating journey to watch. So what if, for example, you have horses that just want to race? It almost looks like in this painting that these horses are dissociating. What if they just want to go to sleep or go graze in the pasture? The poor charioteer or the mind is just doing the best he or she can. After a while, the charioteer may just want to medicate those horses so he can get a break from trying to manage them. Can you imagine how exhausting this might be? Most individuals who struggle with substance use, specifically alcohol, Xanax, benzos, other downers, will describe their brains as racing. I don't believe anyone wants to be an addict. I also believe most addicts are trying to control their horses. Can you imagine how frustrating it must be to go to talk therapy for years and practice all the tools we give them? And then, like the guy in this picture who looks completely exhausted from trying to control his horses, he decides, I just need to have some medication to calm them down so I can catch a break. And then we throw up our hands and we kick them out of our rehab centers or out of our homes. So we know that specific brain-based disorders like substance use disorder are inherited. So why not look deep into the brain, see where there's dysfunction, and then help them train those areas so they don't feel like they need those substances anymore. In fact, neurofeedback gives people back their dignity because we can show them and their families exactly why they are struggling with whatever they are struggling with, and then give them the means to change the root problem. QEEG guided neurofeedback is empowering. So I want to answer the question, how is neurofeedback different than other forms of therapy from a more medical perspective? First, I need to review some basic brain diagnostic tools. There are two basic types of neuroimaging: structural and functional. Structural imaging are like X-rays, CAT scans, and MRIs, and like the term sounds, it shows structures like bone and brain tissue and blood vessels. And so it will show you abnormal structures like a fractured skull or brain tumors or a brain bleed, but they don't show how a brain is functioning. PET scans, SPECT scans, and fMRIs are all functional neuroimaging techniques. And QEEG brain mapping also falls into this category. So the functional neuroimaging, fMRIs, SPECT scans, and PET scans, as well as QEEG brain maps, can show you how the brain is functioning and where it is functioning in different levels. So fMRI stands for functional MRI, which operates by detecting blood oxygen level changes in the MRI signal when brain state changes, such as when a person engages in a task. Cerebral blood flow, and this is important, cerebral blood flow and neuronal activation are linked. So the more activated neurons are, there's increased blood flow, okay? And if an area is deactivated, there is decreased blood flow. So we can see what areas are involved in engaging in different tasks, such as math or reading or spelling. SPECT scans and PET scans involve injecting a radioactive dye, such as radiolabeled glucose, to see how different areas of the brain take up the glucose. Glucose utilization also correlates with blood flow and neuronal activation. So we can see where there might be dysfunction. Again, dysfunction is represented by glucose uptake and blood flow. So if someone is reading, we should see increased uptake in the back of the brain, in the occipital lobes, because that is where the visual cortex is. And if that's not lighting up when somebody's trying to read, then we know that probably there is a brain-based dysfunction for their reading disability. So fMRIs, PET scans, and SPECT scans are only able to be ordered by physicians and cost $5,000 or more. QEEG brain maps, on the other hand, are obtained by gathering information from a 19-lead EEG, which is then run through one or more databases. Okay, so no needles and no injection of radioactive dye. And then the EEG is taken, edited, and run through one or more databases. Those databases have age-match controls. So each site is quantified and compared to the individual's age-match and gender-match control. Brain waves also correlate with blood flow, by the way. Delta, theta, and alpha are the slower brain waves, and those correlate with decreased blood flow. Beta and gamma are the higher brain waves, and they are associated with increased blood flow. So there's a high cross correlation between QEEG brain maps, which are essentially color maps, and fMRIs and PET and SPECT scans. So the data is compiled into tables and then measured in standard deviations away from the mean. And then each site is turned into a color graph. So again, it involves no radioactive material exposure, so it's very safe, typically costs less than $1,000 in most clinics. And there are normative databases, so we can use the data to then show people where they need to train their brainwaves. One of the very first databases developed was the New York University Medical School database, and it's called NX-Link. It was developed by a renowned neuroscientist named Dr. Eroy John in 1977. He's credited with inventing the entire field of neurometrics. Neurometrics is the analysis of brain function by measuring the brain's electrical activity. Dr. John was so committed to translating his discoveries into basic neuroscience, from basic neuroscience into clinical practice. It led to the improvement in multiple neurocognitive and psychiatric disorders. His work led to more than 25 patents in medical technology, and he continuously collaborated with his medical colleagues. Medical instruments based on neurometric technology can also be found in anesthesiology and in the ICU for helping provide treatments for coma and this neurofeedback, which helps people with learning disabilities, autism, anxiety, depression, ADHD. One other example of his discoveries or patents is a device that monitors brainwaves in the OR to detect when patients are receiving too much anesthesia. Reportedly, one of his own devices was used on him during coronary bypass surgery later in life. The second individual to create a database was Dr. Frank Duffy at Harvard Medical School. He is a world-renowned pediatric neurologist who has practiced in Boston Children's Hospital for over 50 years and has authored over 200 papers in his lifetime. Unfortunately, his database is not for sale, but is used mainly for research purposes at his institution. He did author this book, however, Topographic Mapping of Brain Electrical Activity. And I'm going to include a quote here from him because I love it. The literature, which lacks any negative study of substance, suggests that EBT, meaning EEG biofeedback therapy, should play a major therapeutic role in many difficult areas. In my opinion, if any medication had demonstrated such a wide spectrum of efficacy, it would be universally accepted and widely used. It is a field to be taken seriously by all. So that's for my physician colleagues out there. The next database to be compiled was this one by Robert Thatcher, who was a professor at University of Maryland. This was started back in 1979. He was the principal investigator of a project to correlate nutrition and environmental toxins to human brain development, from which over 1,300 EEG recordings were obtained. From this population, approximately 620 healthy normal control subjects were identified based on neuropsychological and neurological questionnaires and interviews. So this database is called NeuroGuide, and it is available for purchase. It has been used in multiple studies, so has been replicated and cross-validated and is considered as accepted science. It has been used by the National Institute of Health, the Department of Defense, and the VA medical centers and universities around the world. This concludes the second video of Module 1, Neurofeedback Foundations. We'll see you soon for the final video for Module 1.